all for attending, and I'll turn it over to Commissioner Allen.
Thank you, Kevin. We appreciate you all taking time today to be with us, and we wish you all a very happy new year in 2021. So last week, the Cuyahoga County Board of Health began our COVID-19 vaccination campaign in concert with our partners at the Ohio Department of Health, our healthcare partners, those in the federal pharmacy program serving long-term care agencies, and all of us together are focused on this first wave of those identified for vaccination in Ohio's multi-phased approach. COVID-19 vaccinations are currently focused on phase 1A recipients. And 1A recipients include healthcare workers and personnel who are routinely involved in the care of COVID-19 patients, residents and staff at nursing homes, residents and staff at assisted living facilities, patients and staff at state psychiatric hospitals, and people with intellectual disabilities and those with mental illness who live in group homes or centers and the staff at those facilities. Also, phase 1 includes residents and staff at Ohio's veteran homes, as well as EMS responders across the state. To date, I'm really happy to report that since we received vaccine just before Christmas, we've vaccinated almost 1,800 people, 350 of which are staff and residents in group homes that were reached through a global team of doctors coordinated by our medical director, Dr. Heidi Gullett. I'd like to thank everyone that's been part of the process so far to make this a very successful start. Our staff, our partners at the Cuyahoga County Emergency Management Agency, the Cuyahoga County EMS providers and communities throughout suburban Cuyahoga County, Community Emergency Response Team or CERT members that are volunteers that assist all over Cuyahoga County, Case Western Reserve University, and a range of other volunteers that have assisted to make this process successful. And all of you in the media that have helped to report on the important work that we're doing. As you know, we've actually been doing a range of planning since the summertime to begin to plan for vaccination. We've had back to school vaccinations that we did through a drive-through process at our building here, as well as some mobile drive-through flu clinics that occurred in the fall. So we've been refining this process and building out what we learned 10 years ago when we did vaccinations for H1N1. The commitment from everyone in this process has been inspiring. Recently, we learned that a web link to sign up for COVID-19 vaccinations that was sent to a range of phase 1A groups was, we know that it was sent out to a range of these groups so that they could sign up for some clinics, and the clinics actually have time and date sign up so that we can manage the flow. You sign up for a specific time. We've done this actually at the last 3 clinics with EMS that we've done in Independence and Shaker Heights, and most recently last evening in Westlake. This link that we sent out to specific phase 1A providers was unfortunately shared more broadly in the community. We don't believe that this was done with any malicious intent, but in order to try to focus on the intent of reaching phase 1A groups, we're establishing some additional screening mechanisms to focus on phase 1A groups. First, those who have made appointments for upcoming vaccination clinics through the link I mentioned will receive cancellations. If they are members of a phase 1A group, they'll be given an opportunity to sign up for one of our upcoming points of dispensing or pods. We're working through a long list of eligible agencies to reach what is a very large number of people in the coming weeks as vaccine is available. If you're a member of a 1A group and receive a link to sign up, you will need to complete an updated pre-registration form in order to schedule a date and a time to receive a vaccine. All individuals who sign up for vaccination will be required to verify that they are a member of an eligible group and required to comply with these issues as well. They include complete the aforementioned survey through the sign-up link, formally attest that they're a member of the eligible group, present an identification from their place of employment and an Ohio driver's license or state identification card at the security screening point at the entrance of the vaccination site. If you do not meet these criteria, you are not currently eligible to be vaccinated, and we ask you to be patient to allow us to work through this very large 1A group. As other groups become eligible for vaccination in subsequent phases over time, more information will be shared with the community. We appreciate the support of you and the media in helping to get the word out for this clarification. We believe many people are not familiar with the phase 1A group and specifically who's included in that phase. And of course, we're hearing from the governor that in the future we'll have a phase 1B process that will include additional Ohioans for vaccination. We'd like to thank you again for your support and patience as we move through what is an immense and historic undertaking here in this Ohio COVID-19 vaccination campaign. So with that, I'd like to turn things back over to Kevin Brennan, our communications officer.
Thank you, Commissioner Allen. So at this point, we'd like to take your questions. So if you would please, when you are unmuted, state your name and your affiliation and ask your question. Thank you very much.
Hello, this is Jordan Vandenberg from News 5. Does anyone have any idea how many cancellations will need to be issued because of the link that went out prematurely?
Terry, could you unmute? We can't hear you.
Thank you, Kevin. We believe that may be on the order of a couple thousand folks. That's a ballpark right now that have been signed up. We actually closed down that link when we realized that it had been broadly and unintentionally shared beyond the intended phase 1A group. So we have the ability through the new system that we're working with County Emergency Management to send emails out. This will also help us with our reminder process, because as you recall, specifically with the Moderna vaccine, there needs to be at least 28 days between the first dose and the second dose. So this will allow us to provide a reminder recall as we do with our other vaccines that come in series to make sure that we get people back in for that second dose.
This is Lisa Ryan from 90.3 WCPN Idea Stream. And yesterday, Governor Mike DeWine said that the vaccination process was moving too slowly. And I'm wondering what you feel like is the speed of the process in Cuyahoga County, and if you feel like it could move faster, and what are some of the challenges and things that you might do to make it move faster?
Thanks for your question, Lisa. So yes, the governor did, of course, with urgency, wants to see shots in arms, as we all do. I think the vaccine arrived here in Ohio just before the holidays. And so some of the complications there certainly were on staffing, and also some of people's general interest in getting vaccine over the holidays. We know that's been varied quite a bit. For us, we're just a little less than halfway through the 4,000 doses that we initially received. And we've been vaccinating before Christmas and here after Christmas, before New Year's. But I think in any process this large of an undertaking, there's going to be some bumps in getting the bugs worked out of an essential process and establishing a flow. We've learned over the last few days about how to maximize our throughput in our drive-throughs working at the fire stations. We have decided where we could use additional staff within the process, how to streamline some of the questions that we must answer and address for instance, the 15-minute period that people have to wait after they get vaccinated to monitor them for any adverse reactions. So these pieces are essential, but I think people are standing up the process as best they can right now. I think we need to be a little bit patient. And also there are a number of people that are still learning about this vaccine and making decisions about whether they're ready to take it. Some folks have told us that they want to be vaccinated, but they want to wait a little bit, and they want to hear from their friends and family that may have been vaccinated to ask them some questions about it. We've been happy to report that certainly the efficacy is very high, as you know, almost 95% effective, which is far more effective than flu vaccine, which is around 50 to 60% effective. And so we're excited about the lasting immunity that will come from this vaccine over time to protect people all across Cuyahoga County and Ohio. But I think we have to be a little bit patient. I understand the urgency. The governor certainly has been pushing us all to vaccinate as quick as we can, and I think that's, of course, his job and appropriate. But I do expect that we will see people smooth out their processes here in the coming weeks. And of course, we can only move at the speed that the vaccine is available. And they're providing, Moderna vaccine and Pfizer vaccine, not just in Cuyahoga County or Ohio or even the United States. Vaccine is being distributed all over the globe. And so we have to account for what will be is this historic logistical undertaking that frankly is unprecedented. So I think all those factors will have some bearing, but to be sure, we're going to continue to move ahead and do our part.
Hey, Terry.
Hi, Terry. This is Mark Namick from Channel
Mark?
3.
Mark, could
questions.
I ask you just to wait 1 second? Matt Wright's been in the hole here for a couple people. Would you mind?
Oh, sure. I have no idea who's in the hold. That's fine. Yep.
That's okay. Please, Matt. I'm sorry, Mark. I didn't mean to interrupt you. Matt, please go ahead.
Thanks, Terry. Matt Wright with Fox 8. A lot of people, it seemed, thought that this link that was shared publicly was a scam. So how will the public know when they're eligible to be vaccinated, and what will the process be for people to sign up when the time is right for their group?
Right. So what we have established now is, as I mentioned, and in the process is we're working through this new sign-up link, which is very helpful for us. We think it's important that we do have sign-ups for specific times, and we've got them down in 5-minute increments, which has been part of our refined process in assessing how long it takes to move people through these pods or points of dispensing. So we have a long list of eligible people that have self-identified to us. We get the calls in the call center. We're able to reach out to them and work with them, and then can forward links for their employees who are eligible to be reached. So we are still in the very early stages of this for 1A, and then of course 1B will be coming in the future. And so as we go forward, we're going to focus on these first priority groups, and as we move forward, we'll continue to provide more information for the public. I think we're still a ways away, perhaps beyond the spring, when we will see general public availability of vaccine. And of course, we'd expect more partners as we move into 1A and 1B, additional partners in the community to assist us, along with public health, hospitals, and pharmacies, all working together. I think it'll be critical, in my view, that over time, by the time we're out there reaching the general public, that the vaccine should be available in the way that flu vaccine is available, more broadly, to give folks the opportunity in many places to receive it. But we just don't have the number of doses available right now to distribute a vaccine that widely, so we just need to be patient.
So just a quick follow-up here. So is it on the folks who are in those next groups, 1B, say, before you move on, to pay attention to the news and the information out there, and then reach out to the Board of Health to get a time slot? Or will somehow they be getting some sort of notice from someone? What should people expect on the actual logistics of, okay, I'm in this group that this is accessible to, what do I need to do?
Right. So I think moving beyond Group 1A, we're still learning ourselves. I think we're going to rely on you and also some messaging, working with the governor on how he, working through our partners at the Ohio Department of Health, wish to roll out 1B. And so to me, that messaging is still in progress. We've identified the groups, and the next stage will be the rollout process on how that vaccine will be distributed and to whom, and how folks that are members of the group should seek to receive it. So we're going to need all of you, as well as working with our state partners, to stay tuned. But I think it's going to be through multiple modalities by which people will potentially learn. We're, again, the early stages of any process of this magnitude, I think, are understandably bumpy. And I think we're in that stage right now. We're still learning.
Okay, we'd like to go to Mark Namick next, followed by Kelly Kennedy, please. Thank you.
Hi, and thank you. I apologize for the interruption earlier. Terry, 2 questions. How many doses does the County Board of Health have on hand right now? And Yesterday, I spoke to multiple hospital officials who said they didn't believe the infrastructure is even in place to do that second phase of 65 and older. And so how is the county preparing for handling that huge wave? Thank you.
Mark, thanks. So we have 4,000 doses on hand. We've distributed 1,800, and we do have a team, as mentioned, a roving team, a mobile team of doctors that, were here very early this morning with me, actually picking up doses to go to group homes to vaccinate those living and staffing at homes of developmentally disabled individuals in the community. So we're somewhere, I guess we're getting close to sort of halfway through our doses that we received last week. And so we're going to continue to run our points of dispensing, continue to reach out in mobile units to those that can't come to us because of their situation. When we talk about 1B, there's no question that 1B is an immense group. 1A is a big group in a county our size. So I think part of this is building the infrastructure of those that have the capacity to vaccinate. And the state is, I think, in the process of trying to assess just who has the capacity to do vaccination to reach this larger group of those over 65 with specific risks, and certainly our school staff, teachers and staff in K through 12. So in a county our size, that is, as you know, is a large task, which is, I think, why my standpoint, it can't be just certainly public health, but we're going to need our hospital partners and our pharmacy partners and others that I think are part of flu, to the normal flu process, which we know works. It's a distribution, decentralized distribution that allows multiple points of access, which also will help from an equity standpoint to assure that those that may not have the ability to drive in a car to get a vaccine can get something closer to home. But we have to allow for that infrastructure to stand up, to build it, because, frankly, we've never done this type of pandemic response for vaccination. And, it's been 100 years. And so I think we're learning and building as we go along. It's going to require, I guess, patience from all of us.
Thank you.
Thank you.
Kelly Kennedy, please go ahead with your question.
Hi, Kelly Kennedy with 19 News. We reported earlier today that the governor said a significant portion of Ohioans who are eligible to get the vaccine have opted out of receiving it. So in that case, is there, would it go more quickly, I guess, to that second group in line, or how would you handle that if some of these people just don't want to get it?
Thank you for your question, Kelly. I think as far as we stand, it may be different in some rural areas, but our phase 1A group is very large. And so, I don't know that, I think some people may have opted out initially. Some people are in a wait and see mode because they want to talk to relatives, as I mentioned, to see what their experience is from the vaccine, because it is new. We know that certainly all the FDA processes have been followed through the trials of over 30,000 people, and the vaccine is very effective. We know that they have not seen many adverse reactions, but at the same time, I think we may see this initial uptake then followed by more interest over time that it will build. But I'd say we're still a ways from moving past 1A and Cuyahoga in terms of reaching that whole group. I think that we will rely on our state partners to decide on how to best phase 1A to 1B and move through these processes and along with our partners. So I think it's my certainly in conversations we've had at some of these clinics, and I've been out to all these points of dispensing, these pods that we've run, talking with a lot of these first responders, EMS folks that are coming through. And some of them are saying, well, their colleagues in the firehouses are, waiting to see how this goes and may have interest in getting vaccinated later. Right now we want to take those that are comfortable and continue to educate the community to try and increase the uptake as much as possible, because we all know and have lived through since March the ravages of this virus, and I think our only way out of this is to vaccinate as many people as we can.
Thank you. If I could just ask a quick follow-up question. At this point, do you have any timeline on when you might move on to that second group? Any idea roughly?
I can't, no, I do not have a timeline yet, Kelly. We're relying on the state health department to work with us and the governor to give us a sense of how we're doing across the state. A lot of best practices are being shared, certainly among health departments. That's how we did it during H1N1, and people are sharing what works and things that they can do to improve their processes to reach and maximize uptake. And so right now I don't have an indication of when that date will be.
Thank you.
If anyone else has a question, please go ahead and unmute yourself and ask.
Hey, Terry, it's Matt Wright with Fox 8 again. Just want to give you a chance to address the community on this, the link that was shared, it seems, by members of the first group. What would you say to those in the community who say this seems kind of like a big mistake, and at a time when information, solid information, is so important, to have this kind of email going out in a way to a group that it's not supposed to get, that it's dangerous? What would you want to tell people in the community about this incident?
So I think, you know, we are working with a new system to try and find the most efficient way to sign people up for very large clinics, and to do it in a way that we think is using technology in a practical manner. We've certainly learned, and will continue to learn along the way, that many people are not fully aware of the groups that are in phase 1A, and so we believe that it certainly wasn't with any ill intent that the link was shared beyond some of the initial target 1A groups. But what we've done now in the process is very quickly, within a matter of less than 24 hours, I'm hearing to institute some controls in the process to refine it and improve it. And so as we go forward, I'd expect there'll be challenges and bumps in the road, but we'd ask their patience and their understanding as we learn and work through this process. And we'll continue to provide the best information that we can. And if there's things we can improve along the way, we will do that. And the public has been great about sharing their thoughts with us through our call center and helping us to understand what's happening on the ground from their perspective. But right now, we do want people to appreciate and understand that we are following a statewide playbook, and help us do that by allowing us to focus on these first priority groups.
Does anyone else have a question for Commissioner Allen? All right. Well, thank you all very much for your attendance. We appreciate it. And our next scheduled update will be in conjunction with the county executive, and that will be January the 8th at 2:30 p.m. Thank you all again, and Happy New Year to everybody.